Hello, my name is Nancy Pulido.
And my name is Karen Tinio.
This is a presentation that focuses specifically on family teaching about isolation precautions, or the use of personal protective equipments, otherwise known as PPEs, for visitors such as family members of the patient who is in isolation precautions.
The purpose is to educate family members in order to demonstrate infection control by using effective use of and proper disposal of PPE to prevent hospital and community-acquired infections.
First, let us define some terminology. Isolation precautions refer to the precautions that are taken in the hospital to prevent the spread of an infectious agent from an infected patient to a person who is at risk for acquiring an infection. These isolations include airborne, contact, and droplet precautions, which we will define later in this presentation.
Another term we need to define is PPE. PPE stands for Personal Protective Equipment. So what exactly are PPEs? These are gloves, gowns, and masks. These may also include caps and booties, which may be optional to wear upon entering an isolation room. So why do we wear PPEs? PPEs act as a barrier to protect the individual from pathogens. This is so that he or she doesn't contract any infection and possibly spread to other individuals.
Now that we have defined our key terms, let us begin with the teaching.
It is important to wash our hands before putting on the PPEs and after disposing them to prevent the spread of germs.
One of the types of isolation rooms that you may encounter in the hospital is the contact precaution room. Contact precautions are designed to reduce the risk of transmission of organisms and specific diseases by direct or indirect contact. Direct contact transmission involves skin-to-skin contact and physical transfer of microorganisms to a susceptible host from an infected person. Indirect contact transmission involves a susceptible host with a contaminated intermediate object, usually a non-living thing, in the patient's environment. Contagious patients in this type of room may have MRSA, varicella, ESBL-producing organisms, multi-drug-resistant Acinetobacter baumannii, to name a few.
The proper PPE for contact precautions include a gown and gloves. On occasion, individuals may wear a cap and booties.
To review, remember to 1. Speak to the nurse before entering room. 2. Wash hands when entering and leaving room. 3. Wear a gown and gloves. And lastly, discard gloves and gown before leaving room.
The second type of isolation room that you may encounter in the hospital is the airborne precaution room. Airborne precautions protect against microscopic particles that can reach deep into the lungs when inhaled. These particles are evaporated droplets that contain infectious agents. Because of their small size, these droplets can remain suspended in the air and can be spread widely by air currents. Contagious patients in this type of room may have swine flu, measles, chickenpox, or pulmonary tuberculosis.
The proper PPE for airborne precautions include a surgical mask. Some patients may be in both airborne and contact precautions room. Therefore, a gown and gloves may also be required. A healthcare personnel will wear an N95 mask.
To review, remember to 1. Speak to the nurse before entering room. 2. Wash hands when entering and leaving room. 3. Wear a mask and a gown and gloves if appropriate. And lastly, discard gloves, gown, and mask before leaving room.
The third and last type of isolation room that you may encounter in the hospital is a droplet precaution room. Droplet precautions are designed to reduce the risk of droplet transmissions of infectious agents. Droplet transmission involves large droplets containing pathogens from an infected person coming in contact with a susceptible person's mucous membranes of the nose or mouth. Droplets can be spread through coughing, sneezing, and talking. Contagious patients in this type of room may have meningitis, pneumonia, scarlet fever, influenza, mumps, or rubella.
The proper PPE for droplet precaution include a mask, gown, and gloves.
And once again, let us review. Remember to 1. Speak to the nurse before entering room. 2. Wash hands when entering and leaving room. 3. Wear a mask, a gown, and gloves. And lastly, discard gloves, gown, and mask before leaving room. Keep in mind that a nurse will do periodic room checks to make sure visitors are wearing personal protective equipment while being in isolation rooms.
Now that you know how to properly wear the PPEs, it's also important to know how to properly dispose them.
Before exiting the room, throw everything in the trash. First, take off your gloves. Second, take off your mask. Third, untie your gown and take it off, making sure to roll it into a ball. And lastly, wash your hands before exiting the room.
We hope this presentation was informative. So the next time you come across an isolation room, don't forget to wear the proper personal protective equipment before entering an airborne, contact, or droplet room to help prevent the spread of infections among individuals. And remember, PPEs does not only help protect the patients, but you as well. So next time, gown up
Before you show up. We would like to give a special thanks to our nursing faculty, Dr. Marilyn Stoner, Professor Cheryl DeBertero, for allowing us to use the Nursing Skills Lab.
and a warm thanks to Elena Cortez, Martin Gutierrez, Justin Paul Ocampo, Robert Stanley, and Blia Yang for participating in our presentation.